Arthur, do you want to start whenever you're ready?
Yeah, thank you everyone for coming to this, the last of our seminars in a series on scenes of shame and stigma in COVID-19, funded by the UKRI and AHRC. We're very, very excited to welcome Dr. Tanisha Spratt from the University of Greenwich to talk to us today, where she's a lecturer in sociology in the School of Humanities and Social Sciences. Tanisha obtained her PhD in sociology from the University of Cambridge in 2019, then spent 2 years as a postdoc researcher at the University of Oxford. Tanisha's research centers on racial inequalities in health in the UK and US, with a particular focus on the role of neoliberalism in promoting and sustaining understandings of personal responsibility, deservedness, and grievability when it comes to illness, death, and dying. And her talk today is titled Understanding Racism-Induced Stress in the Context of COVID-19, Representations of Shame, Anxiety, and Stigma in UK BAME Communities. Thank you, Tanisha.
Thank you so much. I'm just going to share my screen really quickly and just make sure that's all working. Okay, can you see that? Is that all visible? Yeah, perfect. Okay, perfect. So hi everyone, and thank you so much to Luna and colleagues for inviting me to present in this fantastic seminar series. So today my presentation is going to focus on the role of racism-induced stress in racial and ethnic minority health outcomes, focusing particularly on anti-Chinese sentiments that have arisen from the outbreak of COVID-19. And in this talk, I'm going to start by discussing the perceived causes of the disparate impact of COVID-19 on UK BME communities, highlighting some of the initial theories and assumptions that some of you might remember were made when it was initially made clear that the virus was disproportionately impacting minority groups. And then I'm going to go on to outline what we now know about the causes of these disparities. And after that, I'm going to talk about evidence highlighting the role of racism-induced stress in poor health outcomes for minoritized groups. And it's important to note that whilst this work has been studied fairly extensively in countries like the US, it remains heavily under-theorized in the UK, although I know that Professor Winston Morgan at the University of East London has started doing work in this area. So if you're interested in this, you should definitely check out his work as well. I'm then going to move on to talk about the global rise of anti-Chinese sentiment following the outbreak of COVID-19, using specific examples to ground the emotional impact that these everyday experiences can have. And by linking this to my previous point about the role of racism-induced stress in poor health outcomes, I want to suggest that although there was no empirical data linking these two things at the time when I was researching this, it's highly likely that these discriminatory experiences and this increased stigmatization has worsened and is continuing to worsen the overall health outcomes of this group during what is already an extremely difficult and concerning time for everyone. And I want to finish by talking about the accompanying narrative that often follows when people of colour relate experiences of racism, which is that they, or I should say we, should learn to demonstrate resilience and not let these experiences affect us. And what I want to suggest here is that this expectation of resilience when faced with these forms of discrimination can create feelings of not being able to cope as well as other people and transform a structural issue, which is the continuation of racist forms of discrimination and violence, into a personal issue, which is whether the individual is able to cope with racist forms of discrimination and violence. And I argue that this can further lead to feelings of shame in individuals who might perceive themselves as failing to cope when compared with other people who are seemingly succeeding. Okay. So as some of you might remember, at the beginning of the pandemic, some government officials and media outlets referred to COVID-19 as the Great Leveller, because it was experienced to some extent by everyone. Most people were, at least in the beginning, concerned about disease transmission, the effect that the disease would have on the economy and working life, and how new government measures would affect everyday social interactions. However, media reports that followed shortly afterwards detailing the high number of deaths from COVID-19 amongst BME NHS staff showed that this disease is not a great leveller, but indeed disproportionately affects people of colour. Following emerging evidence showing this disproportionate effect, in June 2020, Public Health England wrote a report outlining some of the possible causes of this disparity. In summarising these findings, the report concluded that, quote, individuals from BAME groups are more likely to work in occupations with a higher risk of COVID-19 exposure. They are more likely to use public transportation to travel to their essential work. Historic negative experiences of healthcare or at work may mean that individuals in BAME groups are less likely to seek care when needed, or as NHS staff, less likely to speak up when they have concerns about PPE or testing. This report also stated that, quote, racial discrimination affects people's life chances and the stress associated with being discriminated against based on race/ethnicity affects mental and physical health. And whilst this report didn't really delve into this subject, I want to now turn our attention to how these racism-induced stress responses might contribute to poor mental and physical health outcomes for minoritized groups. In 2006, Arlene Geronimus and colleagues defined the term weathering as a process that signifies the gradual wearing down of the body's systems by stresses that accumulate over time. These stresses can come from multiple sources in a person's given environment, including social or interpersonal sources, for example, through daily microaggressions or unpleasant interactions. These authors argue that Black people in the US, quote, experience early health deterioration as a consequence of the cumulative impact of repeated experience with social or economic adversity and political marginalization. On a physiological level, persistent high effort coping with acute and chronic stresses can have a profound impact on health, end quote. According to this theory, as the body experiences more and more stress, it becomes more and more weathered, making that body increasingly prone to various types of disease and chronic health conditions. This, Geronimus and colleagues argue, is caused by an increase in allostatic load, which is a term that's used to describe how cumulative life stresses result in an altered calibration of the physiological response that our bodies have to stress. And this in turn can predispose individuals to develop inflammatory diseases such as cardiovascular disease and can cause a flare-up of autoimmune disease symptoms. Now, everyone experiences acute forms of stress, and when our bodies undergo physical or social challenges, they temporarily produce extra hormones like adrenaline, and these hormones help us to meet those challenges. And then after those challenges pass, that stress response ceases and our bodies gradually go back to an ordinary regulatory system. But in the case of chronic stress, the body doesn't stop its extra hormone production, which causes high allostatic load. And studies that have looked at this phenomenon in African-American communities have shown that African-Americans living in urban, low-income, segregated neighborhoods are at increased risk for early onset of and mortality related to chronic illness through weathering. And this is because their experiences of environmental and interpersonal racism can lead to chronic stress, which over time increases their risk of disease and poor health outcomes. So here are a few examples of different forms of everyday racism, or microaggressions as they're often called, that can produce feelings of alienation and shame in people who are racialized as other and consequently read as either suspect or threatening. And just to quickly say, I found all of these quotes through either qualitative papers, YouTube videos, or a simple Google search. And I'm just going to read them out. I'll be walking past a car door and people will lock their car, or they'll remove their handbag onto the other side if I sit next to them on public transport. I was walking on the street in London and this guy was following me. He was saying, come on, show me your face, show me your face. And after a few streets, I took my niqab off and showed him my face. I was so scared that I took it off. After a couple of streets down, I put it back on again. There was a physician who wondered where I came from. And when I mentioned my hometown, the physician kept asking, but where do you really come from? Wanting to know which country I came from. But I'm from Sweden. I was born here. It's like, we know you have a foreign background. Can you just tell us where you're from? The bus used to pick us up after school and take us home. One day we were dropping off one of the other kids and there was an old man standing outside his house, watering his grass. When he saw the bus pull up, he came over and started spraying the bus, spraying it through the windows. He was yelling all sorts of abuse and stuff. Repeated experiences like these are exactly what Geronimus and colleagues mean when they talk about weathering. They can lead to mental ill health and can in turn lead to chronic stress, which can negatively impact overall health and well-being. Several studies have also documented how racism-induced stress can increase the risk of individuals developing obesity, which is a known risk factor for conditions like diabetes, hypertension, high cholesterol, stroke, and some cancers. According to one study conducted by Yvette Cozier and colleagues on the relationship between racism, segregation, and risk of obesity in African-American women, quote, greater experiences of racism were independently associated with higher incidence of obesity among African-American women during the period in which the greatest weight gain occurs, young adulthood through middle age, end quote. Exposure to these stresses activates the hypothalamic pituitary adrenal axis system, I really hope I'm saying that right, which releases cortisol, and that's been associated with increased fat retention in the abdominal region. When discussing potential interventions, Cozier and colleagues later go on to argue that, quote, workplace and community-based programs to combat racism and interventions to reduce racism-related stress could be important components of strategies for prevention of obesity, especially in communities at high risk. And various stress reduction interventions that have been developed to address stress related to intimate partner violence and military service might be useful, end quote. And in this way, they offer a practical way to address this issue that gets at the root cause of it, rather than relying on individual change, which is something that I'll discuss towards the end of the presentation. Research shows that not only is racism-induced stress bad for us, it could also be bad for our children. According to Shannon Sullivan in her book, The Physiology of Sexist and Racist Oppression, which was published in 2015, race-related or racism-induced stress can lead to epigenetic changes, which means that future generations may effectively feel the stress of current generations because of changes to the epigenome. In describing this, Sullivan states that epigenetics can be used to demonstrate how racism can have long-lasting effects on the biological constitution of human beings that are not limited to the specific person who is the target of racism, but instead extend to that person's offspring. In this way, the field of epigenetics can help philosophers and others understand the transgenerational biological impact of social forces such as racism. And this phenomenon has also been studied in pregnant mothers who experience post-traumatic stress disorder, elevated stress levels, and increased anxiety after trauma. In a study reported in Science Daily in 2005, researchers from the Endocrine Society presented findings from a research project that they undertook, examining the effects of 9/11 on unborn babies of pregnant mothers. Their findings showed that some pregnant women who were present during the September 11th World Trade Center collapse have passed on markers of PTSD to their unborn babies through transgenerational transmission. In another study conducted by Sahava Solomon and colleagues, they found that there was a higher prevalence of PTSD, as well as mood disorders and anxiety disorders in people whose parents were Holocaust survivors. And in this study, they examined a sample of 96 casualties of the 1982 Lebanon War, whose parents had gone through the Nazi Holocaust, and compared them with casualties who did not have this family history for 3 consecutive years. Additionally, academics have also studied more broadly the transgenerational transmission of trauma, or TTT, as it's often referred to for short, from parents, grandparents, and great-grandparents who have experienced various forms of state and interpersonal violence to their children. And many have found that TTT often results in increased levels of stress amongst those children who relive those narratives through nightmares and reimagine those stories in contemporary contexts. And you can see some examples of this work on this slide. So now I want to think more specifically about the impact of anti-Chinese racism following the outbreak of COVID-19. And I know that Dr. Hannah Farriman spoke in her presentation about the weaponization of anti-Asian stigma, particularly in relation to Trump, and how pejorative labels like the Chinese virus was part of a strategic action under the Trump administration against China. And indeed, referring to coronavirus as Kung flu or the Chinese virus, as Trump did, can be seen as idiotic at best and as a direct attempt to incite violence and give rise to or legitimize racist acts of violence at worst. In the study conducted by the New York Times in March 2020 on the subject of anti-Asian sentiment following the pandemic, Almost 24 Asian Americans who were interviewed said that they were afraid to go food shopping, to travel alone on subways or buses, or to let their children play outside. Some Asian Americans reported being hesitant about wearing masks because it drew more attention to them, which increased the risk of racist attacks, despite wanting to wear masks because their government advised them to do so, and scientific evidence stressed the need to do so in order to reduce disease transmission. Not to mention that in some places it was a legal requirement. And I want to quickly show you a short video that describes incidents of anti-Chinese racism in the UK. This video provides explicit examples of anti-Chinese discrimination and details the mental scars that are often left after physical acts of racist violence and how that generates feelings of alienation. And I also just want to quickly say that the content and images shown in this video might be difficult for some people to watch. So if you don't feel that you can watch them, please feel free to mute your computer and turn away from your screen.
Beaten so badly his face needed reconstruction surgery, Yuan Zhao is slowly recovering from his physical injuries. The mental scars will take longer.
At the time, no one really helped me. They didn't even call the police.
So this is a store you use a lot?
Yuan Zhao was close to his home in Cambridge last month, shopping at the co-op store at the bottom of his street, when he was set upon by a gang who told him to go back to China.
There were like 10 people, so I was quickly outnumbered, and a lot of people started punching me. So majority of the punches was on my head. So I got a broken nose and some injury on my lower jaw and my temple.
The young man who came to study at Cambridge University and loved it so much he stayed, says incidents of hate crime against the Asian community since the start of the pandemic have him reconsidering his future. And for this to happen here in a place that you consider your home, a safe place, how does that leave you feeling?
This incident has a serious impact on me, so I'm really considering moving out of the city.
Figures given to ITV News showing hate crime against East and Southeast Asians up almost 50% since the start of the pandemic become even more shocking in the knowledge that incidents are seriously underreported because of a culture that traditionally does not want to attract attention to itself.
People write to me about language that has been used.
Sarah Owen, Britain's first female MP of Chinese descent, says it's a community living with fear.
It's in the back of your mind every single day when you go out, or when you know that your mum or dad are walking to work or to and from the bus stop. I get it through emails, people saying how it's worsened their depression or that it's really had an emotional impact on them.
Her mailbag is full of messages from people who suffered abuse because of their race. She herself has been abused leaving Parliament.
And this woman just pointed at me and shouted, "Watch out, Corona's about."
So this is more the defensive move.
In London, self-defense classes are being offered to people feeling vulnerable as a result of racist attacks like the one last April that left Darryl Law with a partly detached retina needing surgery to save his sight. He's recovered now, but wonders how he'll ever be able to explain to his young son why he was picked on.
My little boy, he's only 5 years old. I don't want to see him to know that, his dad got attacked. And there'll be questions as to why or what happened. And for me to tell him, oh, it's because the way that we look, he's going to grow up thinking, what is wrong with him?
Their stories are a disturbing reflection of COVID Britain. Even more shocking, the certain knowledge that so many more similar stories, some worse, are going untold. Paul Davis, News at 10.
So as you saw in this video, those who had experienced anti-Chinese racism over the course of the pandemic often described experiences of violence in the form of physical assaults. And whilst the acts of violence that we saw in this video very clearly show overt forms of racial discrimination, with perpetrators often using racial slurs before committing those acts of violence, many people of Chinese descent who have experienced anti-Chinese racism and forms of discrimination over the course of the pandemic have described feelings of being judged, surveilled, and shunned because of their racial identity in ways that clearly demonstrate how covert forms of racism continue to operate in contemporary Britain. And by covert forms of racism, I mean the ways in which racism functions and operates in contemporary societies in everyday forms without the use of racial slurs or forms of violence that are viewed as overtly racist, such as racially motivated attacks. A report conducted in 2020 by Binna Condola and colleagues at Pern Condola exploring increases in anti-Chinese sentiment and prejudice during the outbreak of COVID-19. This report outlined some of the thoughts and feelings that their Chinese participants had about their everyday experiences of being treated differently by colleagues, friends, and people in the street following the outbreak. And here you can see examples of some of the data excerpts from the interviews that they conducted, and I'm just going to read them out. I'm aware that people stare at me and purposefully avoid me before social distancing was compulsory. Even had someone pull their child back away from me in a line. Maybe I'm being more sensitive, but I certainly do not feel comfortable going out anymore. As I am British Chinese, I get treated with more suspicion. Racial slurs yelled from a distance, people coughing at me, people who blame people like me for bringing coronavirus to the country. I know someone, a Chinese person, who was sent a letter accusing them of spreading COVID-19 and was threatened with damage to their home if they didn't sell up to an English family. My dad is nearly 70 years of age and he was out for a walk where he lives in a residential area of Manchester. Some youths went up to him, shouted at him and coughed in his face. What these examples do is really show how pernicious forms of contemporary racism in countries like the UK continue to operate through not only physical assaults, but also heightened surveillance, suspicious treatment, and social avoidance. And these additional covert forms of everyday racism reflect some of the triggers that Geronimus and colleagues note in their articulations of weathering and everyday racism. There's the constant feeling of alienation, with people staring and purposefully avoiding people who they perceive as Chinese and therefore either infected with the virus or responsible for bringing it. There's the constant anticipation of racist encounters, where people might either yell racist assaults or commit racist acts of violence. And there's the issue of others questioning that person's right to be there and the assumption that that person isn't from there. And we can see this in the final quote where the participant's dad was accosted near his home in Manchester. I want to suggest that because of the similarities between forms of everyday racism, racism-induced stress, and negative health outcomes that racialized groups like African Americans face, and reports of racism from Chinese communities throughout the pandemic, it's clear that if anti-Chinese racism persists as the pandemic continues, people in the UK who are of Chinese descent and who experience these encounters are at increased risk of chronic stress and stress-related adverse health outcomes. And this is something that I'm very happy to talk about more in the Q&A if we have time. So I want to spend the remainder of this talk discussing the ways in which these issues of everyday racism and the effects that it has on mental health come up in particular, and how they're often approached, and unfortunately, and somewhat bizarrely, how it's often thought about within higher education as an issue that should be primarily dealt with at an individual level, i.e. through individuals developing coping mechanisms that will allow them to become resilient against the damaging effects of racism. And here you can see a couple of screenshots that I found on various UK university websites, citing the need to build resilience and learn how to individually manage stress by going on resilience building courses, learning about what resilience is, and taking small steps to enhance resilience. And I've noticed that a lot of these calls for individuals to build resilience have cropped up over the past 2 years because of an increase in mental ill health following during the pandemic and after the murder of George Floyd in 2020. These courses and tips are often offered to both students and staff and can serve as a positive way to facilitate mental well-being and other positive health outcomes by providing people with the opportunity to act in order to make effective changes. However, they also run the risk of placing the onus squarely on the individual to change how they respond to a systemic issue, rather than focusing on how to change this issue. And this raises the question of whether it's reasonable or indeed ethical to ask individuals to take responsibility for something that's caused by something that's beyond their individual control. One of the most useful definitions of resilience that I've come across in the work that I do is by Mark Walsh, who defines resilience as a metaphor that captures the ability of something to rebound or resume its original shape following exposure to a stressor. And as Walsh later goes on to argue, quote, the objective of the resilience approach as a technique of governance is notionally to enable individuals, institutions, ecosystems, and economies to be responsible for transforming themselves in the face of a world of contingency, whilst also increasing their resistance to exogenous and internal shocks by limiting the potential of events to provoke change, end quote. By focusing on transforming oneself and resisting the impact that external and internal shocks can have on us, resilience is conceived of as a way to empower people to manage everyday stresses that they cannot effectively control, thus contributing to that person's overall well-being. As a consequence, resilience facilitates an understanding of active citizenship, wherein citizens, rather than the state, assume responsibility for their health and well-being. In this way, one's failure or inability to assume responsibility by demonstrating resilience renders that person an inactive citizen, and that position is often read, and in some cases internalized, as indicative of individual failure. When it comes to dealing with racism, whether that's healing from the wounds of racist attacks or managing the effects that everyday forms of racism can have on our mental health, focusing on developing resilience runs the risk of blaming individuals who are unable to demonstrate resilience because they are unable to cope. And this, in turn, risks presenting a structural issue as an individual issue, which, I argue, stunts the capacity to make effective changes where they are most needed. As conversations about mental ill health have become more common and less stigmatized over the course of the pandemic, discourses surrounding the need to empower people to practice resilience when faced with challenges have increased. And again, I want to stress, I'm not saying that people who invest in learning how to develop resilience to cope with circumstances that are beyond their control are doing something wrong. At the start of the pandemic, I, like millions of other people across the world, found that I needed to more actively practice self-care, which is now a completely overused buzzword, but I'm going to use it anyway, to manage the daily stresses that came from changing rules and regulations around socializing with friends, family members, and colleagues, as well as the ongoing stress of not knowing if or when people that I know and care about will become seriously ill after contracting COVID. In my case, one of the things that I did during lockdown was include fresh flowers in my weekly shop, so that I always made sure that I had a bit of the outside inside my flat. I didn't have a garden at the time or immediate access to any outdoor space, so for me, this was really important. But what I do want to suggest is that we should exercise caution when framing resilience as a lone cure or a form of medical prevention when it comes to issues that are beyond our control but are caused by political, economic, and social conditions that are within the control of people in power. For people who are reliant on food banks because of increased cuts to welfare spending, suggestions that they practice resilience in order to prevent or treat the negative mental and physical health implications of that dependence ignores the structural reasons why that dependence developed in the first place. And for people who experience everyday forms of racism, suggestions that they increase the capacity to cope with racism by focusing on developing resilience to ward off its negative effects risks overlooking the root causes of racism and racist behaviors. And this further risks deviating attention and resources away from dealing with that larger issue. What I want to suggest is needed are real efforts to create systemic changes from the bottom up, rather than relying on a top-down approach that emphasizes and prioritizes the need for individual change in the form of increased resilience. So with that, I think I'll stop there, and I'm very happy to take any questions that anyone might have. Thank you so much.
Thank you very much, Tanisha. That was fantastic. I'll be fielding questions, and if people could use the raise hand function, then I might give a moment for everybody to just absorb and then kind of think of a question, if that's okay.
Oh, yeah.
Yeah. But what a great talk.
And apologize if I was a bit croaky. I'm getting over COVID, so my voice is a bit croaky at the moment.
I see that there's a question from John Noel Viana. If you would, yeah.
Oh, hey, thanks, Tanisha, for a really great talk. So I'm just wondering, you've mentioned throughout your talk anti-Chinese. I'm just wondering, in the UK, for instance, if different Asian ethnicities were also conflated, so that it's like even at the start of the pandemic, even Japanese or Koreans, even though they've been living in the UK for ages, have also been thought or generalized as coming from China, and have also been racially abused. And yeah, I'm just wondering about that. Thank you.
Yeah, thank you so much. Yeah, that's absolutely true. I mean, in the report that I mentioned that was conducted by Condola and his colleagues, that was definitely the case. People were conflated all the time and assumed to be Chinese when they identified as Korean. And as a member of another East Asian group, it was all the same to a lot of people. I'm talking in the past tense, actually, unfortunately, it's still happening. So a lot of the time, people who are from East Asia more broadly are targeted because it's assumed that they are Chinese. And with that is the assumption that they are carrying the virus or responsible for bringing the virus to innocent people who did nothing to deserve it. Thank you. Laura.
Thanks so much for that wonderful talk, Tanisha. I was really interested also when you said about it's very probable that there would be an uptick in weathering because of these sort of racist attacks and microaggressions as well during COVID. And I was wondering if you had any plans to look at that empirically and whether you wanted to share them with us.
Yeah, thank you so much for the question. Yeah, I'm actually starting a pilot study soon. It's slightly different, but it's looking at this case of weathering, and it's thinking about it in relation to Black British communities and thinking about skin color as a variable. So it's basically seeing whether light-skinned Black British people experience less stress from racism and therefore have better health outcomes than darker-skinned Black British people, which is something that's been studied in the US, but it's not really been done here. So I'm about to start a pilot study with ethical approval, hopefully in a few weeks, that's kind of looking at that. And I'm hoping that will inform a bigger grant afterwards. Yeah.
That sounds fantastic.
Thank you.
Looking forward to hearing more.
Thank you so much.
Great. George. Yeah.
Hi, thank you so much for your talk. It was really wonderful. My question is about the aspect of resilience that you spoke about at the end. I'm looking at this for my dissertation in the context of Islamophobia, and I'm wondering if you could discuss briefly, like, how can we responsibly study resilience in the context of looking at racism, such that like our research isn't used to distort like the true effects of what's occurring. But like, I still want to be able to tell the stories of resilience so that there's agency and there's something positive, right? Because some people do have hope, but like, I don't want people to say, well, it's not that bad. People do fine.
Yeah, I mean, that's an excellent question. And if I'm being really honest, I don't have any answers. It's something that I grapple with all the time in my own research, because like you, I don't want to kind of suggest that people shouldn't be trying to do what they need to do to make themselves feel better, to live in a world that they unfortunately have to live in. But at the same time, I worry that kind of push detracts from the need to deal with the root cause of it, or it makes it seem like if you're not doing it, then it's your problem and you need to fix it. I have no one answer for you. It's really difficult. And it's something that you'll probably know that within the resilience literature that's out there, you have people like Nicholas Rose who grapple with this idea all the time and kind of try and think about what it means, but also whether it can be used responsibly. I guess it's an ethical question or like a philosophical question that I'm not, I grapple with it myself, but I'm also very happy to, if you want to email me, to send me, I can send you some readings and things that might help that I've come across, or it might complicate it even more for you, but interesting idea.
No, it's good to keep thinking through it. Thank you, I appreciate that.
Thank you. Amy.
Hi, Tanisha, and yeah, thanks from me as well for just a fascinating talk. I wanted to pick up a little bit about the issue of resilience, actually, and I wonder if you could talk a bit more. I'm just going to try and lower my hand, hang on, and about putting that into conversation with the stuff about epigenetics and into the intergenerational transmission of trauma. I've kind of, a few years back, I was looking at epigenetics and pregnancy and thinking about that in relation to maternal mental health. And one of the things that I don't know the answer to it, I had a failed funding bid about it, so I never found out. was about what those kinds of that kind of knowledge, that's like, the scientific knowledge about epigenetics and what stress can do to the unborn baby, and especially if it's around issues to do with racism that are very difficult, as you've very well set out here, to kind of individually deal with, aside from, kind of suggestions about having, like, I don't know, massage therapy or something, which was some of the stuff that I was seeing coming out of some of the clinical research around epigenetics and maternal health and transmission of stress and anxiety to a baby, suggesting that, well, what we need to do is make sure pregnant women are looked after and have, access to, alternative therapies to help them calm down, which, the way I was trying to think about it was very much, well, what on earth is happening here if, this stress and anxiety is around poverty and racism and these structural issues. So I just wondered if you could just say a little bit more about, and it's that perhaps a question that is a bit unanswerable at the moment, about how we marry those different knowledges about kind of how structural issues kind of might impact on babies and things like that, and then how do we respond to that in a way that doesn't make people just feel awful and like, that's, what can I do in the face of this really challenging context? So
yeah, thank you so much. That's such a good question. I mean, it's really challenging, and I'm thinking specifically in my PhD. I was working in a US context, but now I've been kind of working in a UK context, and obviously grew up here. So I'm thinking about this in terms of conversations that happen in the UK, and my immediate thought goes to funding and the kind of outrage that people already feel when they think that the NHS is paying for things that are the result of people either not taking personal responsibility or not kind of promoting the need for individual action. So I can already hear the amount of people that would kind of be enraged by the thought of pregnant Black mothers, for example, needing massage therapy and needing it on the NHS because they can't pay for it themselves because of the effects of racism. Because either it would be assumed that they should do that themselves, they should either figure out free ways to cope, or they should fund it themselves. It's a difficult one to kind of answer. I don't think that there is a simple answer for it, and I think that so many people are very skeptical about this argument as well. In the book that I mentioned, the Shannon Sullivan book, it was published by Oxford University Press, but it received a lot of criticism and backlash from people that kind of referred to it as being wishy-washy because they didn't really see what she had to say as being real. So I can imagine that the same backlash would happen if it came to kind of spending taxpayers' money on things that should be individually managed. Unfortunately, that doesn't really answer your question, but I think that's because I don't have an answer to your question. It's a difficult one, but one that I really want to explore more. It's a really interesting area. Thank you. Laura, do you still have your hand?
Oh yes, just really quickly about the earlier question around in what context is it ethical to study resilience? And I was wondering, actually drawing on what you said yourself during the talk, whether the right answer might be that resilience and self-care is okay when it's it's something that individuals, particularly oppressed individuals, do to care for themselves, but not okay when it's a political strategy or policy. So in your example, higher education, sort of putting out resilience tips in the wake of the George Floyd murder, that's not okay, because that's people in power who are proposing that as a response. And so, I mean, that might seem very obvious to everyone, but I'm just wondering whether that's where the line is. As you said yourself, is it a top-down strategy or a bottom-up strategy?
Yeah, that's a great question. I mean, I feel the skeptic in me is saying that the lines are actually quite blurred, because when you feel, I mean, using your first example of people needing to kind of practice resilience and doing that for themselves in order to kind of look after themselves, the question is, why do they feel like they need to do that? And that question, when it comes to racism, reverts back to this kind of structural issue that isn't going anywhere with people individually managing how to cope with it. So I'm inclined to say that the lines are quite blurred, but there are millions of people that would undoubtedly disagree with me, who would say that, yeah, it's an individual problem and you should sort it yourself, unfortunately. But thank you. Luna? Oh, you're muted.
Yeah, sorry. Thanks, Tanisha. I really enjoyed the talk. Thank you. So my question is kind of bringing these ideas back to shame and stigma, which are the kind of central themes of our project and our seminar series, and thinking about racism-induced stress and minority stress and weathering. And I just wanted to hear your reflections on how those concepts, which capture a range of experiences, map onto or are related to shame and stigma. And I know I think talking about shame can be shaming, and especially when talking about minoritized groups or individuals or communities, to suggest that shame is an experience that people are having is also can be read as a suggestion that there is something flawed or wrong or deficient with that group or person or community. So I'd just love to hear your reflections on the using shame as a concept and as part of the discourse and language to describe these experiences.
Yeah, I mean, when thinking about kind of anti-Chinese racism, it's difficult in relation to the pandemic. It's difficult because not enough empirical data has been collected yet, and there's a real lack in this kind of research area in the UK at the moment. Hopefully that improves. But when thinking about kind of racism-induced stress, and I'm most familiar with how that operates within Black communities in the US and the UK, there is a lot to be said about the internalization of those feelings of shame and what that does to your health as well. And I have a background, so I'm a sociologist now, but I have a background in English and American literature, so I bring a lot of fiction into my work. So the work of people like Toni Morrison, who really kind of delve into this issue of what it means to feel othered and to feel ugly and to feel ashamed because of that othering and that perception of ugliness, what that does to individual people and how that promotes mental and physical ill health in them. That's an area that I think is really interesting. But again, hopefully more will be done within this kind of area of anti-Chinese racism following the pandemic, so that this can be kind of thought about more. I would assume that unfortunately those kinds of feelings do happen. And actually another video that I was going to include that I cut because I didn't want to run over time, it featured a woman who had this kind of art installation, and she was showing pictures of different parts of her body, and she was kind of narrating the need to hide those things because of this perception of being a carrier of the pandemic or being a cause of the pandemic. So she would literally hide those things from view. So yeah, that also shows an example of internalized racism and shame.
Thank you.
Thank you. And John? Oh, you're muted, John.
I have a sort of a related question to what Luna was actually asking. So just wondering, how did this racist attitudes actually evolve during the pandemic? For instance, when the Delta variant was actually observed in India and was called like the Indian variant, and the latest variant of the Omicron was actually came from South Africa, and people call it South African variant. So how did policies and as well attitudes or the words that were used to describe these variants actually change in the UK? For instance, in Australia, flights from India were banned, but as well as flights from South Africa were banned as well. And were there any emergent racist attitudes towards people who might have a different accent, because that kind of signals that they're from India or from South Africa? Thanks.
Oh, that's a great question and a really big one. I mean, off the top of I can speak anecdotally about this as someone who lives in the UK and who unfortunately has been privy to these kinds of racist conversations since the start of the pandemic. I remember at the start of the pandemic, people said, my sister told me that her friend was no longer going to Chinese restaurants because she didn't want to catch COVID. I've not heard any kind of anti-South African sentiment personally, but I'm sure that there is some. I think though that overwhelmingly this narrative unfortunately goes back to people who are perceived as Chinese. But that is my kind of anecdotal understanding of it. I don't have empirical data to support that. I'm sure that there have been different ways that people have racialized people based on the way that this disease has moved. But I think the perception that it originated in China and came from China, that's been so clearly and repugnantly reinforced by people like Trump, has really grounded this idea that China is responsible, even though we have all of these emerging variants. And actually, when you think about South Africa, there are a lot of people that were kind of applauding South Africa for their response to the variant. by saying that they told us, China didn't. So yeah, I think that sentiment has still remained. But thank you so much for your question. I'm going to pronounce this horribly, which is terrible. I'm so sorry. Lija, can you pronounce your name for me?
Li Jiaozi. Yeah, thank you. Thank you, Tanisha, for your wonderful presentation. Yeah, I'm not sure if I'm formulating it correctly. As a Chinese person myself, who the whole experience of the pandemic has been quite interesting. I'm just trying to think through, because I feel, I know a lot of friends who have experienced racism while they study in the UK, and I know a lot of people who have been through depression. But for a lot of people, I don't think they combine the two. Like for myself, I've definitely experienced racism, but for me, I also feel like I know if I go outside of university, there's more likely if there's a certain supermarket, I'm more likely to experience, but I know I'm quite safe in higher education. I haven't really experienced racism there. So it's like my response, to some extent, sometimes I feel it's like my responsibility to navigate UK properly.
Yeah. So sorry, what was your question? Or was it just like a more general comment? That's also okay.
Yeah, I was just wondering whether there's any studies about the lived experience of Chinese students in their access to mental health and how the connection is made and things like that.
Okay, I'm not sure, to be honest. I'm assuming that there will be studies. What I will say is that in the UK, access to mental health services through the NHS is notoriously bad, with really long wait lists for everyone. So I would imagine that they would find that to be an issue for them as well. Although maybe in higher education, the support that they've been able to gain through different university services has been better. I hope so. But yeah, I'm not, because that's not my area, I'm not 100% familiar, but it's a really interesting area, and I'm hoping that people have done research on it. I don't know if anyone else who does research this more closely is familiar with anyone. Amy.
Not specifically about mental health, but I've just shared in the chat a paper that was co-authored by a couple of colleagues of mine at Edinburgh about experiences of living as yellow women in the time of COVID. It just seemed super relevant to a lot of the chat that we're just having. So but it's drawing on feminist and critical race theories. I know about it, but I confess I have not yet read it. So, but I'm sharing it here for the group.
That's amazing. Thank you so much, Amy. That sounds great. John.
I'm not sure if anyone has any questions that they could ask first before me, or I could just ask it now as well. So just sorry for asking too many. I think this is also my research actually, but more of an Australian context. So I'm just wondering about, I'm not really familiar with British histories. I'm just wondering the history of UK, for instance, were these from a historical perspective, were there actually anti-Chinese or anti-Asian sentiments? For instance, because in Australia, there's a white Australia policy early on, and these sentiments during this period have actually been carried forward until now and have been used by populist politicians. And there is something like an equivalent version as well in the US that prevents migrants from Asian countries or for those with non-English speaking backgrounds. And so I'm just wondering if there's something equivalent like that has actually as well further fueled racist attitudes towards Asians in general. Thanks.
Thank you. Yeah, I mean, that's very possible. I don't know off the top of my head, I can't think of specific policies, but there is certainly a lot of kind of anti-Asian, anti-Southeast Asian sentiment that I know of personally that's kind of fueled things that we all know about and talk about all the time, things like Brexit. There's a lot of kind of anti-immigrant sentiment that's kind of come out of a number of different historic policies, but I'm not sure of specific East Asian policies, although I wouldn't be surprised if they were there. Amy shared something which could also be really helpful, a Guardian article.
Yeah, so a PhD student, Emily Yu, who I'm working with at the moment, is looking at suicide in relation to people who are second generation migrants. And one of the cases she's looking at is anti-Chinese sentiments. And we were talking about this Guardian article, and it's, yeah, so there were some policies in the 1940s specifically around Chinese merchant navy people, which chucked a load of people out, basically. So anyway, the article's there. So yeah, that's one that I'm aware of, whether there may be more.
Thank you so much, Amy. Luna?
Yeah, I was just going to ask a kind of general question. You mentioned a couple of times throughout your talk that like a certain amount of research exists in the States in relation to the experience of Black individuals, and that equivalent research doesn't exist in the UK. It seemed like the research that has been conducted in the UK is quite impoverished in terms of understanding the experiences of racial minorities and health disparities, I suppose. And I wonder, like, the category BAME or BAME or BME, I mean, and how that kind of levels out a whole range of different experiences. Like, is there something about that category that's like intensely problematic in the way it's mobilized in the UK in terms of research, in terms of how we understand the impact of COVID? Like, do you think, I'd love to hear your reflections about that category, or the way that they're kind of bunched together, and what could be different that might make things better?
Yeah, I mean, it definitely shows a conflation of different experiences when those experiences are often very different. So for example, me, I'm Black, but I'm not racialized as Asian. So when I talk about anti-Asian sentiment or anti-Chinese sentiment, the reason why it was so important for me to show that video was because I didn't want to speak for people, because that's not my experience. And this kind of BAME label does exactly that. It kind of groups everyone into the same category when those experiences are often very different. So it's problematic. Having said that, I have used it. I used it in the talk, and I used it because other people use it. And I was talking about government policies, and that at the time, no longer, I don't think. Actually, I don't know, maybe they do. There was this whole kind of thing, I think last year, where the UK government were like, okay, we need to stop using BAME because it's problematic for these reasons. But I think a number of policy documents do still use it. So I don't know what's going on with that, but it is problematic. Yeah, I don't know what else to say about that, to be honest. I do use it, but I try not to use it. And the reason why I try not to use it is for those reasons, but it still seems like a good option to use sometimes when I'm talking of, I suppose some scholars actually say non-white, and that is another way of kind of going about it. And it's a way to kind of highlight the fact that whiteness is often thought of as normative. So that might also be useful. But it also does the same thing. So I don't know. I don't think there are any clear answers, but it is problematic.
Thanks.
Thank you. Hannah?
Hi there, have I appeared? No, I haven't. Yes, I have. Okay, hi Tanisha. I greatly enjoyed that talk. It was really stimulating and interesting. So thank you very much for that. I was just coming really to say that I haven't published on this, but I did have a student, it was an undergraduate student who did some research during the pandemic. It sort of speaks a bit to what John was talking about what the experience was of Chinese/Asian students on campus, and he was Hong Kong Chinese background, although British as well himself. And one of the things that I think is really interesting, and I think this is what perhaps John was getting at, because I think when I was when I did my presentation, I was talking about lineage. I think the lineage for Chinese British people is very complex. And so from his point of view, what he was saying was that he was actually massively surprised by this anti-Chinese sentiment. So he had felt that somehow he hadn't himself had a massively racialized consciousness to that point in his life. This is how he told it to me, and this is then informed his dissertation. And it was a very interesting perspective. So in other words, the pandemic had sort of forced in a consciousness that perhaps it was there, perhaps it's latently there, there's probably a long lineage, but in his everyday life, it hadn't come to the fore, and all of a sudden it was everywhere. And so I think that could be quite different than the other ethnic minority groups in Britain. So I think that was an interesting point. We also had some difficulty recruiting people into the study, or he had some difficulty. And again, that spoke to people not wanting to make a fuss, not wanting to speak out about these things. There were lots of really interesting stuff going on there. Unfortunately, he was an undergraduate and he kind of disappeared off to a wonderful new job. And I'm not sure whether he'd like to publish this data, but I very much hope so, just because it was very insightful, because I think the point I'm trying to make, and I wonder if you, yeah, I think it sort of fits in with what you were just saying, you might like to say a bit more about it, is that these labels like BAME or whatever, or even using labels like Asian, so he defined himself as Asian, but Asian can have quite different meanings in the UK. You know, that's the sort of term that people might or might not relate to, for example. So you know, so anti-Asian doesn't mean even the same thing to everybody. So that these things are very contextualized, but they are really related to these longer lineages and these longer histories, you know, so that not everyone's sitting in the same place when this weathering starts to occur. Does that make sense? And I just wondered if you wanted to say a little bit more about it, for example, in relation to other groups that then became the targets. So I'm thinking of another group that might define themselves as Asian, such as the lepers of Leicester. So groups that were then locked down for significant time periods, and again had quite a strong ethnic minority identity around that. I don't know, what do you think?
I mean, that's so interesting. I want to read your students' work. That sounds.
So do I. He's disappeared.
Yeah, I'm not sure what else to say about that, to be honest. Again, I mean, this kind of area of racism-induced stress is something that I've researched a lot, but again, it's been primarily in Black British and Black African-American context. So I'm not as familiar with this kind of history and this lineage when it comes to kind of anti-Asian or anti-Chinese sentiment. It's something that I've been researching recently. So I don't think there's anything I can really add to that. But again, I really want to read your students' work. I really hope that they're still out there writing these kinds of findings.
Thank you.
Juanita?
Hi, yes, thanks. Thanks for the presentation, Tanisha, it was amazing. I definitely want to know more about your work, and I guess this is why I'm asking this question. Maybe not specifically in the context of the COVID situation, but in general in your work. Have you, just because I was thinking how the whole thing with the resilience is a very, you know, very neoliberal concept, in the sense that it's your duty to do this, but sometimes, and I don't want to generalize, but a lot of racialized communities, we tend to have this situation of you have to endure, you have to do the best. And then when those racialized people are in the context of being immigrants or children of immigrants, then is that a context, like their own cultural context, our own cultural context, kind of influence as well in that sense of shame that generates discomfort that eventually generates health problems? Like, sorry, I'm all over the place right now. Does your research also include that kind of focus of how, I don't know, like colonial pasts and histories can also influence the way in which racialized people and immigrant people in majority white countries or communities can attack themselves in a sense, and therefore also diminish their health through this idea of self-improvement and resilience and endurance?
Yeah, that's such a great question. That is something that I look at in my research. I look at it mostly in relation to Black conservatism, which a lot of people hear as an oxymoron. Someone told me that once when I was an undergrad, and that stuck with me. But yeah, this idea, especially in the US, of having kind of Black parents who have grown up and have struggled more than you have, and then having them kind of say to you, just suck it up, you'll be fine. I was fine, so you'll be fine. And this kind of way that's transmissible through generations is something that I look at. In the UK, I mean, my personal background, my dad is African-American, so I kind of have always been interested in the US and how that kind of works in the US context, because it's something that I've seen. In the UK, obviously, we have a completely different history. So it's difficult to kind of transfer that, but I would imagine it's very similar in the sense that you have parents, if you're a first generation, if you're second generation, sorry, and your parents are first generation and they kind of came over and found it difficult, and then you're saying you're finding it difficult and they're saying, well, I found it difficult, how do you find it difficult? Your life is so much easier than mine. That kind of denial of your experience and the difficulties that you face is very prevalent, and can lead to mental ill health.
That's great, thank you.
Thank you. Anyone have any more questions? Yeah, Fred.
Hi, yeah, really nice talk. Thank you. Really interesting.
Thank you.
I might be guilty of trying to make racism make sense in a way that doesn't actually reflect how things work. But you talked a bit about these kind of like incidents as ongoing, for example. And so I suppose I kind of, when I thought about these things, I suppose I thought of them in the context of these kind of, I suppose, sort of racist myths of like white fortress Britain kind of under attack from like, you know, these are kind of really long historical narratives, but like pollution and disease from like the East and the South. But like, I suppose, sorry, I'm doing this really badly, but my kind of question is, when there's no kind of, when it no longer makes sense to think of COVID as like coming from China in any way, shape or form. So for example, when there's like massively high domestic rates, it's all over Europe, you know, it's kind of coming and going everywhere. Does the tenor of racism change? Does it shift from being like a kind of a specific anxiety about like global mobility and contamination to being more of a question of like responsibility and fault, or is that always threaded through it? Or kind of, I mean, I suppose what I'm asking is, does anti-Chinese, anti-Asian racism change over the course of the pandemic in any way that you can tell?
That's a really hard question, and especially because we're still in the middle of it, so it's really hard to tell what it's going to look like in a couple of years and whether that kind of anti-Asian, anti-Chinese sentiment will die down. The skeptic in me is thinking that a lot of people, not everyone thankfully, will always kind of remember in the back of their minds that the disease was first found in China, and they will still kind of recall these anti-Chinese slurs that people like Trump were using at the time, and that will come out. What's the opposite of skeptic? Thinking more positively. I know personally of people that have experienced it less over the course of the pandemic, and they feel like it's died down a bit. I know people that didn't want to kind of socialize and go outside, both because of COVID in general and anxieties around that, but also because of the fear of being targeted, who now no longer feel that way. But that's very anecdotal, and those are literally two people that I can think of off the top of my head, and I'm sure that a lot of people don't feel like that still, unfortunately. So I honestly, I don't know. It's a question of time. Yeah, it will be interesting and hopefully not sad to see what happens. Thank you. Yeah, John.
I just have a broader question, actually, not just related to COVID, but on generational trauma, because you've mentioned a lot of the like epigenetic effects, but also like the maternal transmission. So do you also like differentiate potentially like the trauma, that there might be differences between, people who actually are migrants, as opposed to, for instance, like Black Americans who have been, a victim of slavery, or as opposed to, people from South Kenya, for instance, who just migrated, like recently. and whether there are potentially different considerations associated with, like health disparities between these new migrants who are from Africa, as opposed to, those who have actually been through multiple generations of trauma, slavery, and discrimination. Thanks.
Yeah, I mean, the literature does kind of suggest that there is a really big difference because in kind of African-American context, that transmission of trauma is rooted in slavery. And because African-Americans have been in the US for hundreds of years, it's very different from, say, someone who's migrating to the US from Kenya and experiencing racism potentially for the first time in that kind of context, being in like a majority white country. There is a big difference there. The question, I suppose, is whether if you were to conduct that study in, say, over 10 generations, whether the effects would be comparable. It's an area that different scholars think differently about. But yeah, it is a different kind of set of literature, because it is really looking at the kind of root of this change. So, and how that change has changed over time. So with for example, different slave generations, how different generations changed the epigenome through their personal experiences of slavery, and how that kind of continued to change during Reconstruction, during Jim Crow, during kind of post-emancipation, Reconstruction, Jim Crow, that kind of generational difference, and whether that kind of shifted and kind of slowed down is another kind of conversation. I'm talking about in terms of speed, that's not very helpful, but whether that, there are some scholars within this kind of area that argue that actually those changes kind of stopped when the civil rights movement happened, and when Black people in the US became more kind of emancipated in the truer sense of the word. I'm very skeptical about that because it's not true, but there are some people that do suggest it, and they tend to be the same people that think that racism doesn't exist because Obama was president. So yeah, I don't know if that answers your question.
I think it's really interesting, and also as well as, like how immigration status as well conflates with racism, because for instance, it's like you could be Chinese, but you could be like British Chinese or Australian Chinese, and then you would be afforded different rights. And once you start speaking with a British accent, for instance, then that kind of like signals that maybe you're less from China, or you're less than someone who actually would still have a strong accent, who people might actually suspect, oh, so you just recently came from China or from an Asian country which has a high COVID rate, and as well as, like how much you could buffer. And I think like Liu Chen really, one of the questions earlier really highlighted, how, for instance, living in a university environment kind of like buffers you from that kind of like racism, as opposed to living in other contexts, but also, your ability to, take public transport or have a car. So yeah, I think that's a really interesting thing.
Yeah, thank you. Does anyone have any other questions? Oh, yeah, go ahead. Ooh.
Hi, thank you. Yeah, I think I'm still trying to think through. I think it's because I'm thinking about like, how do we tease out racism-induced stress from stress? Because like the multivariates in the stress as experienced tend to be quite complicated, and like the racism in the context of pandemic is quite like, yeah, as we mentioned, it's evolving. So like, so at one time it might be perceived as more racist, at another time it became individuals' responsibility to navigate it better. And I was also thinking of in terms of international students. For them it's different, because like they were coming to the UK with expectation to stay for a few years. So they're like in a kind of othered state already, like half connected with their home country, half connected with the UK, and still confused about the health system in the UK. So I think that in itself is also entangled with, because the whole thing about racism is always entangled with being othered, feeling othered, not like, so yeah, I'm just thinking like in terms of, sorry, I'm still not asking my question properly. Like, yeah, how to, yeah, what exactly is, when does stress become racism-induced stress? Yeah.
That's a really, really good question. And it's one that's really hard to answer. So Okay, so there's an area of scholarship that kind of looks at racism-induced stress in relation to, say, environmental racism or institutional racism and things like that, that very clearly draws the link between these experiences within these institutions and within these environments to this experience of stress. If you email me, I can send you loads of work in this area if you're interested. But there is the question of whether or not you always recognize it as racism, and whether this is actually something I'm going to find really interesting, and I'm assuming is going to come up in my pilot study, where you're asking people about their experiences of racism, and they might question whether or not it was racism. I've had that myself on a number of occasions, with other people kind of saying, oh, but are you sure it's because of that? And there's that gut feeling, and you know that it's because of that, but you can't prove it. And so you might start to question yourself and think, am I being too sensitive? And should I be kind of figuring out how to build up my tolerance and not let these things get to me because they're seemingly quite small, which brings in this kind of resilience narrative and this kind of assumption that people should be doing it themselves and should be looking after themselves. There's no clear answer. I'm so sorry. There are so many questions there are no clear answers to, and I say that because I'm still figuring out myself. But yeah, it really, unless it's an environmental question, unless you're kind of studying something like segregation or say like the Flint water crisis or things like that happen specifically within Black areas and Black kind of environments, or things like Hurricane Katrina and how the kind of levees were breached in the Ninth Ward, which is predominantly Black. It's easier to kind of convince critics that the stress that might come from that comes from racism in the form of this kind of environmental structural racism that exists. It's easier to kind of argue that amongst critics than it is to say, well, that person kind of pointed at me and coughed in my face, and I think that it's because I'm racialized as Chinese, because it's very easy then to dismiss them and say, well, you don't know that, they didn't say anything, when you know that actually that was a racially motivated attack. So it's really difficult, and it's even more difficult when you start to question yourself.
Thank you so much.
Thank you so much for the question. Any other questions? Yeah, Fred.
Hi. Sort of turning shame around a little bit. Do you see racist confrontation and racist violence as like a knowing attempt to induce shame in the victim?
Universally speaking, no, but I'm sure that happens. Honestly, I think that those kinds of things happen because, and I don't think a lot of people give a lot of thought to it. I think that they're a knee-jerk reaction to something that's rooted and ingrained. And I don't think people are kind of thinking, let me make them feel ashamed, unless you're talking about, I'm thinking back to the quotes that I mentioned with the woman who was talking about how she was kind of essentially forced to remove her niqab by the man who was saying, show me your face. In that case, I'm assuming there is an element of shame in that, because that person presumably wanted her to kind of take it off and show her face because it was seemingly shameful to some degree to walk around and not show your face. So I'm sure that does happen, but again, I'm a bit pessimistic. My gut reaction is that this kind of othering and this racialization and this racism comes from a knee-jerk kind of rooted reaction rather than a purposeful attempt of shame in a lot of cases. John.
More of a comment than a question. I mean, I think you mentioned earlier that, one of the reasons why people actually underreport is that there is this like culture of you conform, or like, holistic harmony concept in Confucianism, for instance, or like in a lot of like other Asian cultures where, you maintain the harmony of the community. But I think one other structural in a way can be viewed as structural racism as well, is that maybe are there infrastructures actually present for people to report racist incidents? And I think, are these mechanisms actually available in other languages? And are people from, linguistic minorities whose English might not be the first language able to report them, because if there are these hurdles and if there is this lack of awareness of these reporting mechanisms, then that could also contribute to underreporting, because if there's like no Thai or no Vietnamese speakers, for instance, how would people who might not have English as their first language actually report these incidents and seek help, and maybe even seek like police assistance? Yeah. Thanks.
Yeah, that's a really excellent point. I mean, it's difficult enough. I suppose in different institutions things work differently. When I was doing my PhD, there was this program was kind of initiated called End Everyday Racism, that was created by the sociology department but available university wide, and it was for students and staff to kind of report experiences of everyday racism in the university, and that data was then used to kind of shape university policies and to kind of hopefully make a difference in some way. I think the project is still ongoing, but that made it very kind of simple to report things. But generally speaking, bureaucratic processes tend to take a lot of time, and it can be really frustrating. I say this as someone with experience, it can be really frustrating to report things and to keep reporting them and to not see any end result. And I can only imagine how much more challenging that would be if you have this language barrier that's preventing you from reporting something and seeking help. So yeah, that's a really good point. Anyone else have any questions?
I suppose I was kind of thinking about the video as, I mean, like from kind of personal perspective, bringing up, something that John mentioned earlier was about the sort of differences between how people responded to the emergence of the Delta variants and the various South African variants that sort of came up. I mean, a sort of a comment was I was almost, because I'm South African, I thought that the last person who was interviewed, who talked about how he needs to explain to his son that he that why he was assaulted, seemed to have a South African accent. So it was kind of an interesting kind of point of like intersection, I guess, and this kind of question of the intersection of where, you will be assaulted because you present as Asian or as Chinese, but even if you may be an immigrant. I mean, I'm saying that person is an immigrant. I'm just saying from my recognition of his accent, as sort of a fellow South African, he's not assaulted because he's a South African. He's assaulted for being Chinese representing. Obviously, this is, I'm assuming the date of the video is before the variant started to emerge. So there wasn't really my own experience of how people respond personally when they know that I'm South African is far more of on sort of a joke level. So it's kind of also the level of the joke versus the level of kind of covert racism versus the level of overt racism is always like there's a kind of an interesting movable feast, I guess. Obviously, as somebody who presents as white, it's much easier. But I was sort of wondering whether you found yourself in thinking about these instances of of kind of accounts of online of racism that you found online and how they related to shame and stigma, whether there you were thinking at all about Fanon and the kind of archetypal moment in Fanon of being transfixed by the moment of being identified as other and objectified through that identity, through the other. And whether there was something in the laughter that Fanon describes himself responding with as being the kind of correlative to the resilience that you were talking about. So it may be that the question that I've got sort of comment question, is about Fanon and whether there's something in Fanon that almost anticipates the way in which resilience will be coded into responses to the racist moment, being that Fanon tries to laugh it off, but tries to laugh it off even as he kind of gives you this really, I mean, harrowing account of disintegrating before this moment that kind of codes into what will become a kind of resilience movement, as it were. But also then whether we could read some of these moments as somehow reproducing the Fanon kind of archetype, or whether you would see those moments as differentiating or being quite distinct. And if you don't want to answer any of that, then that's cool too. Like, yeah.
No, I mean, I'm writing down notes because this is all really, really interesting, and it's actually really useful for me in the kind of research that I do. Obviously, when I was kind of researching these specific quotes and thinking about people's experiences, Fanon did come up a lot, as did Du Bois and a number of other social theorists. I don't have a way to answer it, to be honest. I think it is interesting when thinking about this kind of response of laughing, and it makes me think of the saying, if you don't laugh, you'll cry. And when you're thinking about that in terms of resilience, maybe then the laughter is an effort towards resilience, because to not laugh is to cry, and to cry is to not demonstrate resilience. It will be interesting to think about whether there is a pressure behind the need to laugh, and to kind of joke it off so that other people can see that you haven't internalized it and you're not affected by it, and whether that is a way to kind of show resilience as well, in a very performative sense, but whether it actually means that you're being resilient because you recognize that you're laughing because your only other response is to cry. Yeah, but it's a lot of food for thought. Thank you.
Are there any more questions? Because I also know that we've kept you and you've been really responsive, amazingly.
No, it's my pleasure.
Great presentation, and then really amazing responses in terms of kind of to people's questions. So sort of give a last chance for any outstanding questions, and then I might let you go so that we don't like.
No, my pleasure. It's been my pleasure.
Well, then I might end it slightly early and say thank you so much, Tanisha, for giving us your time, and for, as I said, a great talk, and also a wonderful question and answer session. Is really, I've gained a lot from this, and I'm sure everybody else has from the comments that are coming up. I can see that they have. So thank you very much. Thank you very much, everybody, for coming.
Thank you so much, and thank you all for all of your questions. I have a lot of notes and a lot of things to write about now, so thank you so much.
Brilliant. Thanks.
Thank
Bye-bye.
you.
Cheers.
Everyone.